Nitrates are normal in urine and they have no clinical significance. But what happens when you have nitrites in urine? When you have nitrites, this simply indicates that you could be having a UTI. And what is causing this UTI? UTI is urinary tract infection. So what's causing this UTI? The causative agents of UTI we know are primarily bacterial infections. Then we also have fungal infections, which are always not very common. And in this case, you could be having yeast infection or the candidiasis. So if you go to the hospital, you're told that you have candidiasis, that is fungal infection back to bacterial infection. So the bacteria that are always associated with nitrites, primarily, or the main culprit in this case, is the Escherichia coli. To add on the list is the Klebsiella pneumonia, and then also we have the Proteus. So all these bacteria are the normal flora in the gastrointestinal tract. But how do they find their way into the urinary tract? So number one, this is cross contamination. Number two, this is the usage of public toilets. You don't know how many people have used that toilet. So when you go there are chances that you will contract this UTI from the contaminated water inside the toilet. I don't know. Now, what happens when you have all the bacteria that I've mentioned before in urine? When these bacteria are present in urine, remember, nitrate is normal in urine. These bacteria possesses, they both possess an enzyme known as nitrate reductase. So what does this enzyme do? This enzyme reduces nitrate into nitrites. So when your urine is tested, it will be positive for nitrite, and when that is positive, this clearly indicates that you could be having a UTI. So to rule out, when nitrite turns out to be negative, that doesn't mean that you don't have a UTI. There are other tests along that can be done to rule out UTI. For example, urine microscopy, and there is also leukocytes. Leukocytes indicates you could be having bacterial infection, but it's not a must that it be the Proteus, E. coli, and the Klebsiella. There could be other bacteria that doesn't have the enzyme reductase, which will convert nitrate into nitrites, that will make your urine to test positive for nitrites. So how can we prevent all this from happening? Number one, when you go to the toilet, how do you clean up yourself? Do you do it backward, front, or front, backward? It should be front, backward. When you do it backward, front, you'll be contaminating. Now, this is what we call cross contamination. When your waste, naturally, the E. coli, the normal flora in the GIT. So we expect E. coli to be in stool because they are normal flora. Now, when you clean yourself backward, front, you are contaminating yourself. So these bacteria will get their way from the waste into the genital area. When they get into the genital area, they'll definitely have access into your urinary tract. So after this, they will multiply. After this multiplication is when you'll be realizing that you are having a UTI. When you go to the hospital, then your doctor will request for a urine test. And when tested, you could be having leukocytes in urine, or you'll be having nitrites, which should not be in urine. Are you getting that? I hope so. Number two, how about if you do it this way? Check on that video. Yes.